Welcome back to the Rundown, everybody. This is a Rundown with Dr. Ciarrah, where we discuss all things running. And today we're talking about running after ACL reconstruction. So for those out there who have torn their ACL and they're asking, will I ever be able to run again? Then this video is for you. So let's jump right in. So let's just very briefly go over some anatomy. So the ACL is one of the four attachments that attaches the femur to the tibia. So your thigh bone to your shin bone, essentially. And it helps provide some stabilization to your knee. Without it, your knee would not be able to withstand forces of running and movements where you have to be sturdy. So, and I'm sure you experienced that if you've torn your ACL before. So it is commonly seen in sports that have a lot of impact, a lot of running, because typically what happens is when you're running or you stop suddenly, your foot is planted and then you turn, that ACL is not able to withstand that force, and that's usually where you have an ACL tear. Now, that is why it's so important to get it repaired. Now, there are some people who do not get their ACL repaired and they're able to still do functional things. It just kind of depends on the person. If you are an athlete and you're trying to get back to your sport, it is recommended that you have that ACL surgery because it will provide your knee with more stability versus it being torn. So you just kind of have to weigh your options depending upon what stage you are in life, what your goal is in terms of activities, what it is that you're trying to do. So that's just something that is going to be a personal preference. So we're just going to jump right into it. So some of the sports that you see a lot of ACL tears in: basketball, football, tennis, soccer, volleyball. I mean, it can happen in any sport. Those are just the ones that you hear about it a lot. So I know today we're talking about getting back to running. So just very quickly, I just want to share some quick examples of some athletes who have torn their ACL and they were able to get back to running. So if you follow sports, Adrian Peterson, he tore his ACL and his MCL in 2011. And after he tore his ACL and MCL, then he went through 8 months of an extensive rehab, and he was able to return back to playing football that next season. And then on top of having a great and amazing season, he was only 9 yards away from breaking a record. So it just goes to show you that if you're putting in the work and you're doing what you need to do, you can get back to running. I mean, obviously football involves a lot of running, so that was amazing. Another person who tore their ACL and got back in the game was Derrick Rose. He tore his ACL in, I think, 2012, and he sat out for an entire season, did his rehab, and then he came back. And I mean, they're still playing. So it is possible that after you tear your ACL, you can get back to running. There are some things that you have to do before that, though. Yeah, there's some work that you have to do, but a question that even before we get to the work that I get often is it even safe for me to run? Simple answer, yes. If all you're doing is running, then no. There is some major foundational work that has to be done prior to even getting ready to run. And I know that there's typically the concern, like, is it even safe for me to run? Am I going to injure my knee again? Am I going to damage it? If you're doing what you need to do, and I am not saying that just because you do your foundational work that does not mean that you won't tear your ACL. I've heard people having multiple ACL surgeries, or they've torn their ACL more than once. However, more than likely, if you are doing what you need to do, it is not likely that it is going to tear again. Now, I'm saying that very loosely because things can happen. I'm not saying, don't say, oh, Dr. Ciarrah said that if I do this, then I won't tear my ACL. Nope, not saying that. I am just saying that if you are putting in the work, if you're doing what you need to do, more than likely that it won't happen. But I mean, if somebody is coming, if you're a football player and someone coming straight for your knee, I can't promise that you're not going to tear your ACL again. Things happen. Just for the general population, you should be okay. Studies have shown that running is safe and it is typically well tolerated, but that's under the notion that there is some type of protocol being followed. So if you're putting in speed work and you're doing your plyometrics, those are the things that are required prior to getting back to running. So if you're running exclusively, then no, it may not be tolerated as well. However, if you're doing some of the other foundational things, then yes, obviously going back to running is going to be safe. You're going to listen to the protocol that is given by your doctor. You're going to follow that protocol, and then your doctor is going to be the one to clear you for running. As I mentioned, the interval training and speed work, those things are going to be very important to getting back to running. However, strength training is going to be even more important. And if you saw the first episode, you already know how I feel about strength training. It is a very important, it is very necessary. You need the strength training. You cannot run in isolation. If that's all you're doing, you're only setting yourself up for more injury. You have to have some type of foundation. That is my bottom line here. Like, if you do not have any foundational work with strength training, then you are not ready to run. You have to put in that work to be able to withstand those forces when you get ready to run, for your body to be able to tolerate the load. Those things are very important. Just jumping into running is going to cause even more problems. So let's jump into when can you run after you had ACL reconstruction. So you want to know when you can run. Well, your protocol, number one, is what a lot of times the doctor will give you somewhere in the 4-month range, 4 to 5 months. It typically says that you can begin running, depending on if you are an athlete and you're trying to get back to your sport. There may be some other time frames in there that may vary for athletes versus just the general population. I typically don't necessarily 100% go by, oh, you're at month 4 or 5, let's get you into running. Yes, it's something that you should be doing. However, you have to look at the person, you have to look at the situation, and you have to look at the goals. So I wouldn't necessarily just say, oh, right at 4 months, let's get ready to start running. Because if you are not at that point where you're ready, then it's no need to push it just because you're at the 4-month mark. Should you be? Absolutely. If you're doing the work and doing everything that you need to do, but every situation is different. You may have had a setback. You may have, had an additional injury. Anything could happen. You may not have had the time to dedicate to your rehab. So you can't just expect, oh, just because I'm at month 4, let me just go ahead and jump right into running. It doesn't quite work that way. If you want to have a successful surgery, if you're really serious about getting back to your activity, getting back to running, you have to make sure that you are following all the protocol, all the steps, putting in your foundational work. You have to do those things to make sure that you're ready to get back into running. So I would not go by a number month. I would just say you have to have certain things checked off the checklist before you just go back into running. I typically go by like, if you can jump, then you possibly are ready to run. Like, you have to jump before you run. I say that often because if you think about it, jumping is just running but with forward motion. So if you're able to tolerate the load of jumping, then there's a high possibility, depending upon what surgery you had and everything, that you may be ready to run. So let's get into some of the criteria that I like to follow before allowing people who've had an ACL injury into running. So before we even discuss getting into running, there's like 4 things that I would be checking. I would check 1 for pain. If your pain is under, let's say, 2 out of 10, then I would say that's a pretty low rate of pain. So that's one of the things that I would check off. If you're still having 5 out of 10, 6 out of 10 pain, you're not ready to run. That's only going to aggravate whatever symptoms that you are already having. So I would just take a step back. Let's evaluate some things. Why am I having so much pain? Let's get that under control before we just start jumping into running. The second thing that I would look at is swelling. Are you still having swelling? Now, I understand that there may be swelling even throughout the first year. And I have met several people who have had their ACL reconstructed, and they say, you know what, still with activity from time to time, I'm having swelling. I'm not talking about just like Occasional swelling, I'm talking about your knee is swollen all the time. You remember right after you had surgery, your knee looked like a balloon, but over time, after you've been icing and then you're getting that blood flowing, your knee starts to go down, and then it gets to a point where it's like, all right, this is my new knee, this is how it looks. Then that's fine. I'm not talking about just like random swelling. I'm talking about everyday swelling. You want to make sure that you're not having any swelling in your knee. And then that's the second thing. So the third thing that I would look for is your range of motion. So of course, we spend so much time trying to get that knee to bend, making sure that knee is straight. So you want to make sure that your knee is at least 95% symmetrical to the opposite knee. You want to make sure that you have that range of motion because you need that obviously for when you're running. So if you have such a huge imbalance between one leg to the other, it's going to make it very difficult for you to run. I'm not saying that you can't. It would just make it a lot easier if they're almost back to normal than when you started. I'm not saying 100% because that's like super hard. A lot of people do get all of their range of motion, and they may end up having more range of motion on their surgery knee than the other knee. It just kind of all depends on what is going on. But you want to make sure that it is as close as possible. And I say 95 because you don't want to have a big discrepancy between the two. The fourth thing would be to have 0 degrees of extension. Those things are important. Decreased amount of pain, less than 2 out of 10. Your knee range of motion in terms of flexion is about 95% symmetrical to the other limb. You have 0 degrees of extension, and then you are not having any swelling. So before you even get into can I run, make sure you can check off those 4 things. And if you can, then we will take it a step further. More criteria. All right, so let's just get into just like a general criteria, some other things that I like to check off. Once we've checked off those first 4 couple of things, then I like to come into some more functional movements and see how my patients are doing with that. So the first thing, I would check and see if they're able to do single leg squats. Now, I would have my patient on like a box or stool, something that's a little bit elevated off of the floor so that you can get the true picture of how they're able to bend their knee, how they're able to recover like once they're down in that squat. If you see any type of valgus going on, which is basically like if your knee is going inward, then that's kind of an indication maybe need to do some more glute work and strengthening up the leg a little bit more, because you don't want to see that when they're doing their single leg squat. I would also check to see their balance. So are you able to stand single leg 30 to 45 seconds without any movement, without any swaying? I like to see that just for like stability purposes. I want to see if you can do 20 heel raises in a row, no pauses, without any pain, without any significant movement going on. I like that one. I like also if you can do squat jumps. Can you do 10 to 15 jump squats with good landings? Again, no valgus going on, and they're like strong stability while they're going up and down. I like those to check off the list as well. I also like to see if my patients can do a single leg bridge. So have your leg up on a stool or a bench, again, something with a little bit of height. Have them do a bridge and have them do about 10 to 15 and see if their hamstring is able to withstand that isolated force. It's tough, it burns, but it's a good way, even if they can't, like now incorporate that into their exercise routine, like help build that hamstring up. But that's a good way to just kind of check and see if their hamstring is strong. And then lastly, I like to have them just kind of jumping in place, single leg, 10 to 15 times, which kind of will bring you around a 30-second mark. Doing that straight, no rest, and just seeing how they're able to do. No pain, obviously, is the goal for all of these. So if you're able to do all of those things, I think that just like general, again, criteria that I like to kind of see before we even start thinking about running. Again, I want to be very clear with this. You're getting the clearance from your doctor. Don't just go home and be like, oh, well, I can check all these things off and I can do them. That means I'm ready to run. Your doctor has to be the one. Sometimes they do imaging just to check and make sure that everything is healed. So you don't want to just take it upon yourself and be like, oh, everything feels okay. Get that clearance from your doctor. Because one of the things that I know for a fact, after you've gone through all of this rehab, the last thing that you want to do is injure yourself. So follow the protocol. Don't try to to jump ahead too quick. Don't try to say, oh, I feel fine. The doctor is babying my knee, making me go super slow. It's for a reason. They're surgeons and doctors for a reason. They've given this a lot of thought. You're not the first person that they've worked with that is following this protocol. So just listen, be patient, and do what the doctor is saying. Now, strength is a major component of being able to get back into running, especially after you've had ACL reconstruction. One of the things that I've seen with some physicians, they like to have isokinetic testing done for their knee. It's not always performed, but it is a good indicator to check the dynamic strength of the knee, which is important because running is a dynamic activity. So if you have a MD or if they suggest you to go and get some isokinetic testing done before they clear you, it is something that you can do. I mean, it is not obviously a requirement, but if you just need that final check, you just want to make sure that everything is okay, then go or ask them where you can go to get that testing done. It's just going to give you numbers. If you're a number person and you like to hear like, okay, this is how close this leg is in terms of strength to the unoperated leg. So that is just another way that you can kind of just make sure that you're in the clear before you get ready to go to running. So I want to talk about mentally being ready to run. I know a lot of times when I'm discussing with a lot of my patients, they're just saying, well, I don't know if I'm ready. Now, I know that we've put in the work. I know that they're strong and I've taken them through these same things that I just discussed. So it's like, oh, I know that you're ready. But for them, it's just a mental thing. And I truly believe that this plays a huge role in your recovery, because if mentally you're not there, if you're talking yourself out of it, oh, I can't do this, or I'm not ready yet, or I think that I'm going to injure myself, which is the one that I hear the most. Like, that is where the fear comes from. And I understand that, because it's like, well, I just spent 8 to 9 months rehabbing my knee and now we're running and this is how I injured my knee in the first place. So I'm scared and afraid that I'm going to do that again. I understand that. However, if it is something that you truly have been dedicating your time, your money into rehab, and you've been putting in the work, then I just want to encourage you to trust your knee, trust yourself. I mean, you have been working super hard to get to the point of even being able to run. It's a big deal, especially coming from a brace. You can barely walk, you're on crutches, and then you're talking about running. That is a really big achievement coming out of rehab. And so I feel like if you're struggling, like, I just don't know if I'm ready to get back to that, I'm afraid I'm going to injure my knee, just try to get all of those negative thoughts out of your head. Just speak positivity into your life. You can do it. If you've been doing the foundational work, you've been strength training, you've been doing interval work, speed training, if you've been doing plyometrics, if you've been jumping, you've been doing all of those things. And not just like a few days. If you've been rigorously doing the work, putting the work in, then I believe that at that point you would be ready to go into running. You just have to believe in yourself, believe in the process that you've been going through, trust your therapist. If you can do all of those things and talk positivity into your life, then I think that it would make running a lot easier. Now, if you still can't get over that hump, I know that a lot of times people see sports therapists. It's, I would say, probably a newer concept, but I think that it is very valuable, because sometimes you just are in your own head and it's not a bad thing. You just possibly could need to talk to someone, just like, hey, every time I get ready to run, I am just ready to talk myself out of it. So I would just suggest that if you can't get some positive mantras going and just talking to yourself and being positive, see if you can just talk to somebody else, especially if you're returning to sport, because it, I feel like, is a different thing versus just running. But if you're returning to your sport and your performance, all of those things, it plays a role. So you have to have a positive mindset before you even go out to run or whatever sport you're doing. So just, that's something to take into consideration. All right, so let's discuss just really quickly some phases that if you're getting back to running. This is just kind of general, again, phases that you can kind of go by. once you're ready to get back into running. So first things first is the walking. I mentioned this in my previous video as well about walking for 30 minutes. I feel like that is just like a pretty good place to start. If you can walk for that 30 minutes with less than 2 out of 10 pain, and you can do that pretty consistently, then that's one of the, I guess you could say, prerequisites prior to getting ready to running. If you can do that, then I would say that in phase 2, let's get into some plyometrics, which would involve a lot of jumping. Just being able to withstand that force and still not having any of that pain, that's another step in the right direction. Now, once you go to phase 3, which would just be of like running and walking, because now you realize, all right, so my walking is fine, I'm not having any pain doing that, I'm able to jump, and whether that's just like doing some jump rope or like not doing jump rope and kind of just like jumping in place, or if you have the agility ladder, getting in some jumps there, another way that you can kind of see. And then once you're doing the walk run, now this phase is important because you want to kind of walk and you want to run and you want to play with the number. So maybe like the first week or so, you're just doing like running for 2 minutes, walk for a minute. Got that? Okay, no problem. Then after that, you can progress 3-minute run, 1-minute walk, whatever it is. You just kind of want to play with the numbers, but keep progressing. And then after that, you can get into, okay, well, I'm going to go run for a 10-minute run, 15-minute run. You just want to ease your way into it. You don't want to go too fast. You don't want to push yourself too hard. But at the same time, you have to keep adjusting whatever it is that you're working on so that you can make it to that final goal of just being able to say, hey, I'm about to get up and then go for a 20-minute run. So since you had your ACL reconstruction, I just want to point out that it may take you a little bit more time to warm up than it previously did, so it wouldn't hurt to start off with some dynamic stretches. When I say dynamic, I just mean anything moving. So if you were used to doing stretches where you're just standing in place, save those for after the run when you're doing the cool down. But prior to that, if you're doing your high knees, do it, but do it walking. So like walk across the field or down the street, whatever it is. You just want to do some things that your muscles are able to warm up so that when you get going, it's not a shock to your body. Your body's not like, hold on, I need more time to get into the groove. So you can start off with some running drills. You can do some skipping, you can do some hopping, anything to just kind of get those muscles warmed up and ready to go. I definitely would suggest doing that prior to any of your runs. It will save you a lot more injury later on down the road. You don't want to pull a muscle. You don't want to hurt anything. Again, you just spent all this time doing your rehab. So now is the time to get back into running, get back to your sports. And the way to do that is to warm your body up so that you can prevent injury. We don't want to go backwards. We want to go forward. So make sure that you're not just jumping out there thinking that, oh, I didn't have to do this before. Well, you didn't tear your ACL before and you don't want to tear anything else. So you want to make sure that you're keeping your body healthy. You're making sure that you're doing all the right steps so that you can enjoy your sport, enjoy your running. You want to leave the rehab in the past. I'm sure you don't want to go back down that road again. So just make sure you're doing the necessary things to keep your body healthy. One of the last things that I want to mention is about strengthening. I know prior to even getting to the point where you were discussing with your physician about running, I know you spent a great deal of time strengthening your leg, doing whatever you needed to do. I'm proud of you, commend you for this journey. I know it's not easy. However, one thing that I want to say is don't slack up on your strengthening. And although you may feel like, oh, well, I've already spent 6 months doing this, I'm good, I don't need to do it anymore, that is the furthest thing from the truth. You need to make this into your routine. You need to continue working on building your quad. You need to keep on making sure that your hamstrings, your quads, your glutes, your calves, all of those muscles are super strong. You need those for just daily function, but especially if you're thinking about running, especially if you're thinking about returning to sport. It just has to become your new regimen of making sure that you put in that extra work, extra strength training for those muscles, because you have gone through a traumatic experience and you want to just make sure that your knee is able to withstand whatever forces are coming its way. So you don't want to slack off on the strength training. You may not have to spend every single day doing strength training, but doing something that's keeping that knee active. That can be the strength training. It can be plyometrics. It can be doing your cardio, which would involve the running. You just want to make sure that you're staying active and you're doing everything to keep that knee nice and strong. Now, I understand people sometimes also take breaks from things, or you're just like, I'm just tired of working out. I don't want to do it. If that is the case, make sure that prior to getting back into your activities that you're incorporating all the stuff that you learned in rehab, your strength training, and you're getting those muscles strong. You don't want it to just be, oh, I do it just for a little bit, then I'm just going to forget about it. You got to keep the knee healthy. And you don't want to get out of it and just think you can jump right back into it. Again, these are how injuries happen, and we want to prevent that as much as we possibly can. So do whatever you have to do to keep your knee strong. Be consistent. Consistency will help you a lot, because if it's in your routine, you don't even have to think twice about it. So don't just do it for a little bit and then be like, I'm okay. We want your muscles to be strong. We want them to be able to withstand whatever forces you have coming your way. So we need you to strength train, strength train, strength train. If y'all know nothing, learn anything else from me, it's to strength train. You need it. You need to strength train. All right, guys. Well, that's all that I have for you today. I hope that you learned something new. I hope that I've encouraged you to definitely run after you've had your surgery. I think that it will be amazing, especially if it was something that you were doing before. And how victorious will it be? You were on crutches and now you're running. So I just hope and want to hear some of your stories about getting back to running after you had your ACL surgery. Leave it below. If you like this video, please like it, subscribe to our channel so you don't miss any of our upcoming videos. And we'll see you next time on The Rundown with Dr. Ciarrah, where we talk about all things running. Bye, y'all.